Bornhold, and I'll be giving a short presentation on my educational intervention directed at the underserved population of El Cajon, California. Introduction: health-related problems identified. I will be discussing the 2 health issues that were a focus during this educational intervention at the Grossmont Care Clinic location. Number 1, improved nutrition for the homeless population of El Cajon. Community of El Cajon has 77.9% homeless, highly accessible cheap fast food, and lack of nutrition education for the homeless. And 2, chronic diabetes in the same underserved area of El Cajon. Community has a large quantity of cultures with genetic predisposition. Poverty in the community forces the population to eat cheap fast food, low quality packaged foods. There are a lot of grocery stores with just very cheap, low quality foods in the area, and they have a lack of diabetes education. Background and significance of El Cajon, California. I focused on this underserved area located in San Diego County. This area is known to those in San Diego County as a low-income area with cheap rents, abundant multifamily dwellings, lots of apartments, cultural diversity, lots and lots of cultures, drugs that are easily accessed, crime, poverty, and all of the above have a very large number, and above all, a large number of homeless people residing there. That's one of the most obvious things I noticed. There is an overabundance of high-fat fast food restaurants available in the area. This, coupled with high poverty rates and unemployment rates, create the perfect storm of unhealthy food choices based on income and a lot of other circumstances through interviews. The interview section during my windshield survey, it became very apparent that there were issues with the population's health literacy, lack of fitness, lack of motivation, awareness to make changes for health and lifestyle. I felt that the underserved population of El Cajon was a perfect area to perform the health education interventions, focusing on nutrition and diabetes. Healthy People 2020 objectives. We want to improve glycemic control among persons with diabetes, and we want to increase the variety and contribution of vegetables to the diets of the population, the homeless population. Excuse me. Needs assessment. A community health nurse, like we're trying to be now, must submerge themselves in order to figure out the needs of the target population in a specific area. The windshield survey allowed me to do just that. I drove around El Cajon, absorbed the overall feeling of the area, which was run down, overcrowded, unmaintained, and had a high prevalence of homeless sleeping and living in walkways. Very obvious homeless population. Population as a whole was in need of better nutrition based on many obese people I did notice during my drive through the community. The area was very diverse with large populations of Hispanics, Arabics, African American, and minority number of Caucasians. Key stakeholders I finally nailed down. I discussed the area and its health education with Mark, the director of the Grossmont Care Clinic, one of the RNs, RN-BSN, and everything else under the sun. His perspective was invaluable since this population is constantly in the clinic, and it did resemble my perspective during my windshield survey of the area as well. He offered his experience and insight in regards to untreated mental illness being a major concern in the area, leading to depression, poverty, obesity, difficulty maintaining employment, securing health insurance, or stable housing. A lot of these things, the reason why all of this started was untreated mental illness in that area. I also conducted a very informal short interviews with many members of the community. These people's perspectives and concerns all allowed me to gain even more insight on the immediate needs of the area. They were talking about depression, lack of access to money, employment, affordable housing, lots of drugs, alcohol, because of depression, and they did not know anything about their health. They had no idea, and they didn't really know that they were supposed to change it or should change it. Theoretical framework and model we used was the precede proceed model, and it was like a roadmap to define the outcome which was desired. We started from the end and worked our way back to the beginning. This model begins with the consequences, works backwards, and finds the causes. During my population intervention project, I used this model as a roadmap, allowing each phase to guide me in regards to what I should be assessing and considering in order to put together an effective intervention. Many questions must be answered about the population, and the precede proceed framework, it really did help me find those answers through the different 8 phases. Definition of desired goal, close look at the population, we got to do that. Examines what's influencing the population, what, the environmental influences, social influences, establishes what resources, structure, procedures are required to actually, perform an intervention, how to put the plan actually into action, and it reviews follow-through, accomplishments of goals, real-time effects of interventions on the population, and shows achievement of initial desired outcome through time. When you have a lot more time than we did, it shows all these things at the end, phase 7 and 8. Issues. What are the issues within the underserved community of El Cajon? The windshield survey portion of the formation of the intervention revealed obvious and underlying issues within the population. The underserved population was high risk and chronic sufferers of diabetes, and lots of homeless people in El Cajon. They continue to experience high rates of poverty, financial limitations, low quality, cheap foods, easy access to drugs and alcohol, depression because of the lifestyle, a lack of desire, lack of motivation to make changes, and mental illness left untreated is such a big deal. It's just often looked past in that area. There's so many. The windshield survey did clearly show major community access, for both populations in terms of counseling and resources geared to get homeless into jobs and housing. And moreover, the underserved population had many cultures, customs, and diverse languages, which have education, had to have education provided in these languages, as well as interpretation services for those whose primary language was not English. The issues were, obesity, abundance and access to cheap food, poverty, all these things in diabetics. Homeless, big time, the biggest thing, mental illness untreated, drugs, alcohol, cheap, high sugar foods, fast foods, and lack of awareness. The intervention. What was used to facilitate this intervention? The location was chosen at the Grossmont Care Clinic. It's right in the center of town. Right in the middle. This clinic was easily accessible and in a well-known location that provided many free services to the homeless and to the entire community. Just outside the clinic was public transportation, the bus, the trolley. It was perfect. 2 education presentations were provided in a small little section of the waiting area at the clinic. They were so nice to let me do that. The first presentation focused on nutrition for the homeless. I brought in real food labels, handed them to the clients, and instructed them on how to read it and decide if it was a healthy food choice. And I did not put the name of the food on the label. I just had them, educated them on what they were looking at rather than just a picture of something that was good or bad. Pictures of fruits, vegetables were shown to the clients and emphasized on how these foods can help them stay healthy. Protein source images such as chicken, fish, lean meats, things these people should be eating were shown, not fried, were shown on the PowerPoint presentation. The clients were asked to select food choices, healthy food choices from pictures to show that they understood what I was talking about. All the clients were present at this lecture did speak English, thankfully. Some of them spoke multi-languages, but they all did speak, they could speak English. 8 people were in attendance at the presentation, at the diabetes presentation. They were provided with maps. No. The homeless population was only 8. They were given maps to the approved food banks, soup kitchens, shelters, and crisis houses, as well as more, resources. Same techniques and materials were used on the diabetes prevention and maintenance intervention. 10 people attended that one. Each person at the presentation was provided diabetes screening, point of service blood sugar check, and the diabetes educator was so nice. He donated his time to, after the presentation, to sit with everybody and take everybody's blood sugars and help, explain, the glycemic control, in a way that they could understand. These clients spoke English and Spanish. It was just English and Spanish, and were able to verbalize the understanding of diabetes education provided, and they did. These education interventions, I hope will have an impact in regards to, attaining our Healthy People 2020 goals, improving glycemic control, as well as diabetes prevention, maintenance, increasing the variety and contribution of vegetables to the diets of the population and the homeless in this case. Budget. This was cheap. This was very cheap. It didn't cost much at all. Planning and actually performing a health education, a big one over a period of time, does cost money, time, manpower, suitable locations to perform the intervention. In terms of this short educational interventional project, it was very cheap. The cost was low. Equipment for the media and education was loaned or borrowed, or it was mine, donated through the Grossmont Care Clinic, like the strips for the glucometers. They gave them to us. It was very nice that they did that. We got to borrow the equipment. Others who assisted in providing education, like the diabetes educator, volunteered their time. I paid for the paper to print the pamphlets and handouts, and the food labels. I just used those from home. I created the materials provided, volunteered for the time spent researching, with the pre-seed, proceed, traveling to the clinic site, providing the education to the clients, the training to discuss diabetes risk and management, as well as improving nutrition for the homeless had already been achieved through my work experience and through my ADN nursing education. Project evaluation and outcome. Diabetes, my hope for these people that attended the educational intervention is that they were left with new knowledge they could actually use to increase the quality of their health and maintain their diabetes or prevent it. I want them to be interested and have sincere desire to improve their lifestyles in regards to either diabetes care and prevention. I discussed the basics of diabetes, the topics, lifestyle, risk factors, insulin, blood sugar, diet, obesity, genetics, during the presentation. Not too much, and I spoke in a way that they really did understand. How did I evaluate their understanding? After the class, I asked each participant, all of them, the questions that are listed above. I asked if they could verbalize 4 symptoms of diabetes, and most of them could. 9 out of 10 could. Population participants, I asked them if they could describe the risks, what's going to happen to their bodies if they just don't take care of their diabetes. And 9 out of 10 did, verbalize an understanding of what, how important it is and what's going to happen if they don't maintain it. Homeless clients, 8 homeless clients participated in this intervention. They were so nice. They were eager to learn, discuss what they knew and did not know. During the intervention, I educated them in regards to food labels, fruits, vegetables, all the things I discussed before. 8 out of 8, all the homeless people, they could verbalize an understanding, and they seemed really excited, just happy to be there. Asked them if they could demonstrate how to read food labels, and they did. They understood. And asked them if they could pick 4 fruits and vegetables that they would choose if they were by themselves, at the soup kitchen or a grocery store, or even a fast food restaurant. You can still pick a salad. And so they did verbalize their understanding about how to pick healthier food choices. Results and conclusions were pretty good. I felt pretty good after such a short time. Summary, given the short time, the frame, time frame in which we provided the interventions that I did, the underserved population of El Cajon, in that area, I felt my health education intervention was a success for these people. I was able to accomplish all the goals in the framework in the pre-seed, proceed. I performed the windshield survey and needs assessment, focus on the homeless, chronic diabetes risk patients that were very noticeable. 2 successful, each class was 15 minutes with 15 minutes of questions, answers, demonstrations. I felt all the objectives were met. Felt the participants not only learned new skills and information to assist them, but they had fun. Everybody had a good time. The staff at the care clinic was helpful, and they were very willing to provide the location, the additional education, the glucometers, the equipment. Very nice. The weaknesses, it was too short of a time frame. The class was short. The intervention was quick. I couldn't get a lot, accomplished. It was just very short. Too much to do, too little time, very small number of attendees. I tried to get more, but it was not easy. The problems I inquired was difficulty finding willing sites to actually take on my intervention. Nobody wanted to do it. Nobody wanted to stand behind it. because of policies and procedures and liability. And I had a difficult time meeting with stakeholders. Nobody had time for me. They all had problems with their schedule, so that was a limitation and a problem. These are my references. I really did have a good time. I had fun with this. So thank you for listening today, and I hope that this was easy to understand. I kind of went different circles, but I hope you got the idea of what I was doing. I enjoyed working with the people of this community and providing them with these educational interventions. Everybody have a great holiday. Eat a lot of food. School is over. Take care.